You know that feeling, right? You're staring at a claim denial, and it feels like you're trying to solve some kind of cryptic puzzle. Well, you're in exactly the right place. Because those denial codes, they're not just random numbers. Nope, they're clues. And today, we are going to become master code breakers. I mean, really think about it. Every single denial code is a piece of a bigger puzzle that's gumming up your revenue cycle. But here's the secret, and it's a good one. Every puzzle has a set of rules, and once you learn the patterns, you can solve it. Every single time. So let's just dive right in. Over the next few minutes, I'm going to hand you the keys to unlock a whole series of codes, specifically CO codes 58 all the way through 121. We are going to take all that confusion, turn it into crystal clear clarity, and start flipping those denials into approvals. You ready? Let's do this. Okay, first up, we're tackling the absolute fundamentals, payment and coverage errors. These are the codes that flag the really basic stuff, like where a service happened, what was actually covered, and who's supposed to get the check. You know, if you can just nail these details on the front end, you'll prevent so many fires on the back end. Just look at how straightforward these first two are. CO58, that's just a location mismatch, super quick fix. And CO96, well, that's the classic not covered denial we've all seen a million times. Now, the obvious fix is just to remove the charge, right? But the proactive fix, the real game changer, is running a thorough eligibility check before the service is even performed. That is how you get way ahead of this one. And then there's CO 100. This one is always so frustrating, isn't it? The payer sends the check directly to the patient. So solving this isn't really about fixing a code on a claim. It's about picking up the phone. Your very next step has to be coordinating with that patient to get that payment. It all just boils down to communication. All right, let's keep moving. Our next set of codes, it's all about the paper trail. This is where really simple administrative mistakes, like, sending the claim to the wrong insurance company or just forgetting the proof, can stop you dead in your tracks. CO 109 and 110 are just perfect examples of how one tiny wrong click can completely derail a claim. You send it to the wrong payer, or maybe you just mix up the dates. Hey, it happens to the best of us. The good news, these are such simple fixes. Just correct the info, resubmit it, and you are right back on track. Okay, lean in for this one because it's a biggie. CO 112. When you see service not documented, you've got to understand what's happening. The payer is literally throwing down a challenge. They're basically saying, prove it. Prove you actually did this. And this right here is why meticulous documentation is your absolute best defense. The fix isn't about changing a number. It's about digging up the proof, chart notes, signatures, anything that validates that service, and sending it right back with your appeal. Next up, we've got two more really essential checks. CO 111 is all about making sure you're properly in-network and that you've agreed to the payer's terms. And CO 115 is just about keeping up with reality. If a procedure gets postponed or canceled, the claim has to reflect that. It's all about making sure the claim is an exact snapshot of what really happened. Okay, time for our final section, and this one gets into the real money issues. We're talking about what happens when a patient hits their benefit limit, or, and this is a tricky one, when a payer needs to correct a mistake they made in the past. Let's break down these three very different financial scenarios. First, CO 1117. This is a logistics check for transportation. Payers are only going to pay for the ride to the closest appropriate facility, period. Then you have CO 1119, which is a hard stop. The patient's benefits are maxed out, and your focus has to immediately shift to patient billing. And finally, CO 121. This is the big one, a takeback. The payer is adjusting this claim because they overpaid on a previous one. Your job here, you have to become an auditor, double-check their math, and make sure that clawback is 100% accurate. So, we've cracked a ton of codes. But fixing denials one by one, that's just playing defense. The real power, the real win, comes from playing offense, from building a system that stops these denials before they can even happen. So let's shift our thinking from just fixing to actually preventing. This right here, this is your cheat sheet for a much healthier revenue cycle. Look at the pattern that emerges: verifying info upfront, documenting meticulously, knowing the patient's limits. This is all about being proactive. It's about building a workflow where accuracy is the default setting, not a lucky exception.
And really, that's the ultimate takeaway here. This knowledge completely transforms your role. You're not just a claims processor anymore. You're a financial detective. You're a data analyst. You're a strategist. You are actively safeguarding the financial health of your entire organization. Now that is a powerful shift in perspective.
So I'm going to leave you with this to think about. As you look back at all these codes we just discussed, which one is the biggest bottleneck for your team? Which one of these puzzles are you solving over and over and over again? Because identifying that one pattern, that's the first step to solving it for good. Thanks for cracking these codes with me today.